thank you for joining us. This month, we will discuss what does the Interpreter Services Program cover. Our first topic will be who is covered. The Interpreter Services Program offers interpreter services for Medicaid-covered and Department of Social and Health Services social service appointments. Medicaid is financed and operated jointly by the states and the federal government. Medicaid patients have to pass eligibility verifications, as some benefit packages are not covered or have different eligibility based on the service type selected. You can find this information in Provider 1 under their benefit package, or you can simply submit the interpreter request through the LanguageLink portal and we can verify for you. We'll talk a little later about issues with verifying eligibility. One of the common insurance questions we get is about Medicare versus Medicaid, known also as Apple Health in Washington State. I thought it would be helpful to provide these simple explanations to give a brief overview into the difference. Medicare is an entitlement program funded entirely at the federal level. It is a health insurance program for people age 65 or older, people 65 and younger with certain disabilities, and people of all ages with end-stage renal disease. Apple Health, or Medicaid, is a needs-based program with eligibility determined by income and covers a wider range of healthcare services than Medicare, for example, dental. Now, some individuals are eligible for both Medicaid and Medicare. These clients are known as dual care patients. But only Medicaid is eligible, and you would need to enter their Medicaid information. So how do you identify a Medicaid client and where do you obtain their information? The image on the front portion of this screen shows you what the Provider 1 or Medicaid card looks like. On the front of that card, you can identify the first and last name and their Provider 1 number, which is 9 digits, always followed by WA. You will need their date of birth and their gender to submit the request for an interpreter so that LanguageLink can verify their eligibility. Your obligation under Title VI, which was created in 1964 under the Civil Rights Act. This states, no person in the United States shall, on the ground of race, color, or national origin, be excluded from participation in, be denied the benefits of, or be subjected to discrimination under any program or activity receiving federal financial assistance. As we just discussed, Medicaid does receive federal financial assistance. This means that your Medicaid clients who do not speak English have a right to an interpreter provided to them at no cost. If the interpreter rendered services when the client was ineligible, the Healthcare Authority will deny these claims. That bill will then be forwarded to your office. We do verify eligibility 48 hours prior to the appointment taking place, but the Healthcare Authority and LanguageLink does recommend that providers always verify eligibility the day the service occurs. In certain cases, as many of you may be familiar with, eligibility often changes on either the last day of the month or the first day of the month. If you have an appointment scheduled for April 1st, and LanguageLink had verified 48 hours prior, the eligibility may have changed based on the date of the appointment. If you check and verify eligibility the day the service occurs, this can result in less time and effort, and even perhaps money, on your end. HCA will pay for interpreter services if the client is an eligible Medicaid client, the interpreter is authorized to provide services under the Healthcare Authority contract with LanguageLink, the interpreter is DSHS certified or qualified, and the requester is authorized to provide services to Medicaid clients. The Healthcare Authority will not pay for an interpreter if the interpreter is asked by someone other than the doctor or the doctor's staff in a specific request, the interpreter is a member of the client's family, or is not contracted with or approved by the Healthcare Authority, or the medical service is not covered by the Healthcare Authority medical benefits package. The Healthcare Authority does not pay for an interpreter for administrative services, such as scheduling appointments, filling out paperwork, and of course, reminder calls. These are considered administrative services and are responsible by the provider. Inpatient hospital services are also not covered. Services provided by any other facility, agency, or provider that is required by federal or state law, regulation, or rule to provide those services, such as public health agencies, public hospitals, and/or local health jurisdictions. Nursing facility services, substance abuse services that are covered through DSHS, or behavioral health services that are covered through regional support networks. As a way to ensure patient eligibility for various services, healthcare providers are required to submit information about inpatient, outpatient visits, and service type when scheduling interpreter appointments. What service type do you select? One thing you can do is verify with your billing department, or you can reach out to LanguageLink or the Healthcare Authority, and we can help as best we can. Now, will you be notified if the patient's eligibility changes before the appointment? As previously stated, LanguageLink does verify eligibility 48 hours prior. Now, if the patient's eligibility has changed since the initial request and they are no longer eligible, LanguageLink will cancel the appointment and notify the provider and the interpreter that the appointment no longer exists. The provider is then expected to verify the patient's eligibility. Thank you so much for joining us this month. You can always reach us by phone at 1-800-535-7358, option 3, by email at hcaproviders@language.link, or 24/7 answers to your questions at www.hca.language.link.